Okay, you guys, no matter if you're training for something big or you're just trying to get lean and stay healthy, your body requires a lot of protein. In fact, around 1 gram per pound of body weight. Now, cooking whole foods is best, but I'm going to be honest, sometimes I need help hitting my protein count with clean, on the go nutrition that works for both myself and my family. But that is a lot harder than it sounds. I've been searching for months to find a super clean, affordable protein powder that actually tastes good, has a full amino acid profile, and doesn't upset my stomach. Finally, I found Equip Foods Prime Protein. And seriously, you guys, I am hooked. Prime Protein has over 2,000 5-star reviews because there's no junk, fillers, or additives ever. Equip's unflavored grass-fed beef isolate protein powder has only one ingredient. All of their flavors taste amazing. Vanilla happens to be my favorite. They mix well. They can be added to countless low-carb and keto recipes. You can make a quick shake with just 1 scoop and get a 21-gram protein instantly. You guys, that's like eating 4 ounces of steak. Every single batch of Prime Protein is certified non-GMO and is free of glyphosate and heavy metals. If you need a delicious, easy to use, easy to digest, clean protein powder, seriously, you guys need to check out Equip. You can save 15% off with my code DRFIT, DRFIT, at equipfoods.com. And by the way, every single bag comes with a 100% happiness guarantee. So if you don't love it, send it back for a full refund, no questions asked. Welcome to the Fit and Fabulous podcast with Dr. Jaime Seaman. Hello, everybody. It's Dr. Jaime, and welcome back to the Fit and Fabulous podcast. It is so incredible to have you back today. I think you're going to love today's guest. I have been obsessed, honestly, with this topic that we're about to talk about ever since Mark and I met. And the more and more and more I learn about the human microbiome and the oral microbiome and its connection with chronic systemic diseases and pregnancy. That's right. Even going to be talking about the women's health world. And it's really fascinating what's going on inside of our bodies. So let me introduce you to today's guest, Dr. Mark Cannon. He received his doctorate of dental surgery from the University of Nebraska. So go Big Red. And then he attended Northwestern University. Yeah, for his master's in pediatric dentistry. He completed his residency at Children's Memorial Hospital and received his diplomat status by the American Board of Pediatric Dentistry. And he's a past president of the Illinois Society of Dentistry for Children, a professor of Otolaryngology Division of Dentistry at Northwestern University, Feinberg School of Medicine, and a member of the International Association of Pediatric Dentistry. In addition to maintaining a large private practice in the suburbs of Chicago, he also does a lot as a research coordinator in the residency program there. And he does so much work with the American Academy for Oral and Systemic Health. That's how we met. He's presented lectures all over the country, you guys. And in addition to all the work he does in his field of study, he's also a proud father of 5. All his kids are very accomplished, and he is a very proud grandfather. Dr. Mark Cannon, welcome to the Fit and Fabulous podcast.
Thank you so much, Jamie. I am so happy to be back doing this. This is something I love to do. It's my mission in life, has been always to do research, teach, and practice. I am now currently retired from private practice as of May, so there's a little update.
Congratulations.
And I'm the president of the American Academy for Oral and Systemic Health. I speak a lot about oral and systemic health, and that's actually how we met. And you were so gracious to be a speaker at our annual meeting in Phoenix, Arizona. And I thank you again for doing that. That was fabulous. No,
Yeah. So for people that don't understand, there is this incredible conference called Collaboration Cures, and it is the connection of dentists like Dr. Cannon and regular medical doctors. It's also attended by hygienists and nurses and other healthcare professionals, but a way that we can collaborate as healthcare professionals to kind of understand this connection between what happens in the mouth and what happens in the body, because there is an absolutely undeniable connection between what happens in those places, and it's bidirectional. So let's kind of dive into that. First of all, when people go into dentistry, of course, we think about just getting your teeth cleaned and fixing teeth. But where did like this passion with your area of research really stem from in your career?
Well, in dentistry, it started way back in the 1800s. In fact, at first, dentistry was a specialty of medicine in many countries. And then it split off completely on its own, as you know. In my career, I didn't know how closely they were united until I did my hospital residency back in the 1970s when I went to Children's Hospital. And I realized that every patient we saw that had a severe medical issue, they often ended up with severe dental issues, which would complicate the medical issues. But as you've said, over the last few years, especially the last 2 or 3 years, we find that the connection is unbelievable. That the oral pathogens, that's the bad bacteria in the mouth, have evolved so much. And remember, in biology, nothing in biology makes sense except through the eyes of evolution. And when I lecture to students, I say nothing in dentistry makes sense except through the eyes of evolution. So we've evolved to have these microbiomes, groups of microorganisms, whether it's in the mouth, the nose, placenta, wherever these organisms are, we evolve with them. Many are friendly, the vast, vast majority. If we die, they die. They're very friendly. They help us with everything, digestion, help tune our immune system. Then you have the pathogens. Well, some of the key ones in the mouth, the bad bacteria, the pathogens, actually create havoc throughout the entire body. So much so, the National Institute of Health and Center for Disease Control has specified one as a keystone pathogen. This one bacterium, we'll just call it PG, not only creates gum disease, but inflammatory Alzheimer's. And they can
Mm,
prove that by simply giving the bacteria to mice, and the mice go through cognitive decline. They look like they have Alzheimer's under the microscope behavior, and they also get prediabetes, insulin resistance, and they gain weight. But of course, you know where we're going with this too. You give it to those mice, and you give them the bacteria from a woman with preeclampsia, the mice get preeclampsia. So there are so many different studies now, there are animal studies showing a direct link and the causation, and they know exactly down to the little most infinite detail of how this is occurring. It is to me extremely fascinating because I got my start going thinking about microbiology back in the 70s. And now I know that microbiology is essential in all of healthcare.
wow. Okay, so you said the word human evolution. Now, it would seem that dentistry and orthodontics and endodontics and all of these special areas of the mouth essentially are professions of the modern age. I don't know how far back the work of dentistry really runs,
I can
but
tell you.
can you? I'm sure you could spout it right off. But can you tell? You said the word human evolution, so can you talk about human evolution in teeth? I'm sure some of my listeners have heard of like Weston Price
Oh, yeah,
and
absolutely.
what he learned about
Oh, yeah.
teeth, but we didn't always have bad teeth like this. So can you give us some insight to that? Why do we have such bad mouths now?
Well, actually, the first fillings go back to almost 13,000 years ago, but they were happening during the very beginning of the Neolithic period. It was actually the Epi-Paleolithic period, the end of the Mesolithic period, where we went from being hunter-gatherers to having a lot more grain. So just remember, when people started to eat cereal, basically basic concept, teeth got worse, and we got a lot more cavities. Although gum disease goes back 20 or at least 30,000 years ago, that's a different story. That's a disease that jumped to humans and back to dogs. So dogs and humans share a very similar gum disease, and now cats after domestication about 10,000 years ago. So we have to look at our anthropological history and the evolution of all this, and we realize you said orthodontics. Well, this complex of the face, the craniofacial respiratory complex, how the face developed, to help us breathe through our nose and support our nose. Orthodontics is the treatment of the maladaptation because of changes that we have endured in our evolutionary trait. There's a lot more orthodontics. The jaw has gotten more narrow. The upper jaw specifically has gotten a lot more narrow. And oddly enough, Jamie, microbiome changes have contributed to that too, because one of the key reasons for kids to have obstructive sleep apnea or sleep disturbed breathing is poor nasal respiration. It's an incredible story. I love this story because it shows how it's all bidirectional and it's a vicious cycle. So if you have wrong bacteria in your nose, and just very recently, in fact, I'm still publishing it. I just finished the rough draft a few days ago. We did the deep sequencing of the nasal microbiome, so we know all the bacteria and the primitive bacteria and the viruses inside the nose. And a lot of the good bacteria in the mouth are also in the nose. And then some are also mouth, nose, and gut. Wow. There's good bacteria that protect you everywhere. But if you don't have the good ones in your gut, you get more allergies. Every study has shown that, right? Gut
Mm.
microbiome, gut issues lead to allergies. Allergies lead to nasal respiration issues, which lead to mouth breathing, which creates more nasal respiration issues because the mouth breathing causes the tonsils and adenoids as well in these kids. And that's why, according to famous studies published by the CDC, by like Karen Budnuck and others, so in 3 to 5 year olds, between 20 and 30% of kids have sleep disturbed breathing. That disturbs your
Wow.
microbiome. That sets them up to have all this gum disease and cavities. Famous study done, published, International Journal of Otolaryngology, the ENT guys again. They looked at kids having their tonsils and adenoids out, hundreds of them, because of airway issues. They couldn't breathe because of large tonsils and adenoids. Over 62% had moderate to severe decay. All of them had dental disease from the mouth breathing. So every dentist, if you see a child with an issue with teeth, first thing they're supposed to look at, are they breathing okay? Because believe it or not, Jamie, the majority of my patients prefer breathing.
So when you're like let's
That
say
was a
somebody's
joke.
listening right now and they look over at their kid. Oh, I know. Well,
It's my bad sense of humor again. Just the majority of people prefer
you're,
breathing, not everyone.
you're not breathing. You're dead. You're dead. But when you say like make sure they're breathing, like how could somebody look at their kid right now and say, "Is my kid breathing normally?"
But do they snore?
Okay.
Because snoring is important during pregnancy and it's important in children. Snoring is never considered normal in a child. That's been repeated many times. Snoring's never normal in a child. And you have to look out for snoring during pregnancy. When I talk about preventing disease and I talk to a large group, I always start off prenatal, which I know you have to enjoy a whole lot. We always start off prenatally because, again, the study is showing that even just snoring, asking the spouse, is there snoring at night? If it was, were they snoring beforehand? Three things: pregnancy onset snoring, chronic snoring, and pre-pregnancy weight are very important factors. If you're overweight to begin with, you're at much higher risk. Of course, everyone is. The more weight you have, the much higher risk you are, period, for airway issues.
Well,
There's actually
everything.
fat
Yeah.
back in there, everything, yeah. And so if you have acute pregnancy onset snoring, that's so easily treated by the dentist with just a mouth appliance and won't be any long-term effects. They all should be screened. Every pregnant woman should be screened for that. They actually should have their microbiome screened too, because as you know, and you've talked to some famous people on this, that certain bacteria increase the risk of miscarriage and low birth rate. And
Yeah, but
actually
nobody's
still,
testing for it.
I know,
Yeah. Or
still,
even aware, honestly. When we see a patient with recurrent pregnancy loss, until I started diving into this world, I mean, I remembered in obstetrics and gynecology residency, they would say things like, look in your patient's mouth, ask about gingivitis, ask about, chronic tooth issues, and that there was some connection between that and pregnancy, problems. But that was literally like the level when I come out of training that what I know. And now what I know is like wow, right? Like I recently had a patient with multiple recurrent losses, and we're working on getting her tested, her mouth for some of these bacteria, because we've tested all these normal things that I was taught to test for with recurrent pregnancy loss, like a uterine septum, antiphospholipid antibody syndrome, diabetes, thyroid dysfunction. So I've ruled all these things out, and what am I left with, right? So now I'm harboring in on her oral microbiome, and sure enough, I start asking about it, and she's got mouth issues, she's got tooth issues, she has issues in her mouth, and I think that's the cause. So
Easily
this is
could be.
like,
There's so much research on that, and it should be one of the first things people look for. But you went down the whole list, which is very admirable. Sometimes it's amazing because I work with physicians all the time and with medical groups that will be having a conversation, and I'll be saying, "Why didn't they look at this or that or this?" And finally, someone in the back goes, "How come you didn't look for this?" I'm going, "Hey, I'm not the only one thinking about this." So,
yeah.
yeah, there's so much we could do for patients, and there's so many ways we can intervene. That's a positive thing. I always say you should prepare for pregnancy before you get pregnant, not just obviously monetarily too, and time wise. Oh, by the way, I have two new grandkids since we last talked.
Congratulations.
Yeah, I had two come in the month of July, and I do all this because I think it's the best thing for the new generation. I want my
So
grandkids to
what
grow up in
advice
health.
what advice would you give your children, or about these new babies? How would somebody listening right now, how would you establish, you know, oral development, oral microbiome for these babies? Let's talk about that.
Well, of course, that's very funny to me because kids never listen to their parents anyway.
Never. They do the opposite, in fact.
So you have to be very, very careful on how you word things. But yeah, you have to eat the right foods. I mean,
Okay.
absolutely. When you're pregnant, you have to eat the right foods. And when the baby's born, and the baby should be breastfed if at all possible. Everyone knows I have been actually yelled at for lecturing on that in certain locations, but the reality is breast milk is loaded with bacteria. In fact, it has the who's of all the probiotics. It's just absolutely wonderful how much good that is in breast milk. In fact, most of the fats in breast milk aren't for the baby. It's actually for the baby's microbiome, develop the microbiome, which develops their immune system. That's why there's so much, breastfed babies are much healthier. They just get sick a lot less too in studies. But a lot of it comes from the mom. That's why with the mom, if the mom doesn't have the right bacteria, and this is something we know for sure from some famous studies looking at the HUDs of babies and comparing them to babies born in like the Western world, we're missing at least 20% of the bacteria that we should have. And I
Wow.
stress the bacteria that we should have. We tend to be missing our probiotic bacteria. And these probiotic commensal groups, they seem to be more susceptible to environmental changes. They seem to be more acceptable to antimicrobials. It's kind of like my old example of if you spray your backyard with Roundup and everything dies, what grows back first?
Mm,
The weeds.
the weeds.
Yeah.
Yeah.
And a lot of these pathogens, they're just a little bit more hardy and they tend to
Interesting.
survive better. And there's this vicious little cycle going on, which is really interesting with pregnancy. If you eat a lot of sugary stuff, you're going to boost the population of a bacteria called strep mutans, which most people have heard about because strep mutans causes cavities. Now, strep mutans also can cause heart infection, endocarditis. It can cause infection of the brain. It can cause encephalitis of the brain. And it also can cause and contribute to the spread of oral and throat cancer. That they've only known about for the last 2 years about the role in cancer. But strep
Interesting.
mutans is killed by a good guy, which is another strep called strep oralis, which produces hydrogen peroxide, which kills the bad guy. But wait, the bad guy produces more of what kills the strep oralis. They produce this antibacterial is like an antibiotic. It's called a bactericin. So it kills the good guys. So they're always fighting a war. So in your mouth, there's always a war going on, and they all have allies. The good guys have allies. Like the good guys will have the Neisseria bacteria to help them, and they produce nitric oxide, which kills the bad guys and drops your blood pressure. And that's why there's a direct correlation between high levels of the good guys in the mouth and a good pregnancy. A normal pregnancy without high blood pressure, without abnormal weight gain, if you look at the moms, they have a higher level of the Neisseria bacteria. That research is fascinating. They have a higher level of the serum nitric oxide. And nitric oxide opens up the blood vessels, so more oxygen gets everywhere, including the baby, and it also kills the bad bacteria. I mean, it's like however you want to say it, God or Mother Nature came to our defense and gave us allies to protect us. Our problem is we've been killing the good guys all the time.
And it's from what we're putting in our mouth and not breathing correctly. Is that what you're
Yes.
saying?
Yeah. Yeah. A lot of the preservatives, a lot of the antimicrobials. Just recently, there was a little disagreement going online in a group of specialists I belong to, and someone were talking about using chlorhexidine. And one of the very well-known researchers said, in Europe, chlorhexidine in the mouth is banned because it raises your blood pressure within 1 day. And they don't
Wow.
even know about it here. It's also been linked to some cancers because it kills the bacteria that help prevent cancers in the
Who's
mouth.
putting chlorhexidine in the mouth?
Oh, there's companies selling those products and there's dentists using it.
Wow.
Yeah. And,
Wow.
and it's actually doing more harm than good.
Like a swish and spit kind of thing?
Yeah,
Or
swish and spit. It's doing more harm than good. It stains the teeth. But they go, I've had patients come in, well, what happened to your teeth? They're all brown. They go, well, I think it's from that mouthwash. And they're using this high chlorhexidine mouthwash. I go, and who
wow.
told you to use that? And they found out from someone who called in a script form. But we should not. We have to be so careful. Good food. I know you're big on nutrition. I know your background.
But
Good
tell
food.
people what to eat. Tell people what to eat to help their mouth.
Well, we
What's
can
the
just
and you've told a story I think of human evolution too and carbs, and you clearly just said the grains, once we had commercial agriculture and grains and cereal, that was an important time in evolution that we started really hurting our mouth and our teeth.
Oh, you
But
know
tell
the
people
average
what they should eat.
the average size of the hunter-gatherer population, Homo sapiens, after they started to go to agriculture, dropped by 6 inches of height.
Hmm.
That's well published in the Journal of Human Anthropology. 6 inches of height because of malnutrition, because grain doesn't give you nutrition. It gives you carbs. You get a little bit. You always get a little bit here, and there's always a little bit in there. The only
Energy, but not
really good
nutrients.
thing that came from the grain was really with Naledi, because the Naledi were the ones who discovered if you took grain and left it in a vessel with some moisture, over a period of time, it would produce a marvelous liquid beer.
Alcohol.
Yeah, they
Which is
discovered beer.
also, can we talk about what alcohol does to the oral microbiome?
Yeah, well, not that alcohol because it was like a 2-3% beer. I mean, alcohol beer.
Yeah.
So it was like ship beer, but like
The stuff they sell in Kansas. Yeah.
that 3.2. I remember those days in Kansas. 3 point. They still sell that in Kansas.
They yeah, well my brother went to K-State University, and if you bought beer in the gas station, it was like 3.2 beer. You had to go to the liquor store to get the real beer, but they didn't tell you. So, you were just buying
Well,
the lesser
Kansas
stuff.
used to
But
have a drinking age of 19, but for 3.2. You couldn't have anything above
oh,
3.2 till you hit 21. It wasn't such a bad idea. It was a dual-edged sword. It taught you could drink a little bit more responsibly, and yet it trained you to drink about twice the amount of volume you're going to be able to handle later. So it didn't really work out. Uh, that's the
okay, so back to the diet. Okay, so I need you to hit this home for people. Obviously, I eat a very meat based, carnivore diet. Let's say we have somebody listening that's vegan, but eating like whole foods. all the way to somebody eating carnivore and somebody in between that's moderate carbohydrate. What are the impacts of those types of dietary choices, even if they're just whole foods, they're not eating processed foods, on the oral microbiome?
It's really interesting because, we actually did do a study, a very, very good study that is in the process of being published with 30 kids with autism, definitely diagnosed with autism, no question. 30 kids from a blue zone in Colombia and 30 kids from the United States who were healthy. The 30 kids who were healthy were extremely difficult to find. No
Mm,
one can believe me how hard it was to find 30 really healthy kids in the United States.
wow.
Healthy BMIs, no history of medications, no allergies, anything like that. So basically, the whole food kids were the ones from the United States who were healthy. They were actually quite healthy, but they did eat a lot of meat. They also stayed away from anything processed, but they ate, I have to tell you, it was grass fed beef mostly. They were eating a lot of pasture raised chicken, the
I mean,
eggs.
Were these like Amish children? Because
No, they were
like,
not, but I have to tell you, like the
yeah.
moms
I
would
mean,
tell me,
in urban areas, that is,
I know.
not common to see.
Well, actually, it's becoming more common now, actually, in many parts of around where I'm at. I hear this all the time. They would actually send all the lunches to school with the kids in a paper bag because they didn't believe in using plastic. They so convinced me because every one of those kids was articulate, bright, very pleasant, no behavioral problems, and very healthy. And that just completely blew me away. Because again, I'm
Yeah.
a
Wow.
pediatric specialist. The kids
Hmm.
from the blue zone in Colombia, again, they were on a very restricted diet. So their microbiome was nowhere near as diverse. They were on a restricted diet because the blue zone was a blue zone because first the narcos controlled the area and then the FARC, the guerrilla terrorists. So who's going to build a fast food restaurant there? No one. I mean, you wouldn't survive trying it. So the reality is, yeah, I'm a big believer. As you know, my youngest son was a really big carnivore too, and became very, very healthy and had a lot of great muscular development with that. And we used to, as hunter gatherers, get 79 to 80% of our diet from meat.
Yeah. And these days, consumption of beef products is down, and chronic disease is
Up.
up.
Yep.
But that's
Yep.
the, political vilification of, and the rules that commodities versus, whole food products like milk and egg and beef, and what we're restricted and what we can say about them. I mean, it's a whole nother podcast, but yeah, people are definitely eating less meat. I've heard too with meat eating. What does that role play in like chewing the meat, like with oral development, like with
Oh, that
kids?
is huge. In fact, as you know, we have everyone always involved in these projects like baby-led weaning and all that, but babies need to chew. They need to develop their jaws. If they don't develop them properly, then they'll end up having very narrow jaw structure, which will never let them have a good airway. Sadly, if the upper jaw is too narrow, the tongue can't fit where it's supposed to up in the roof of the mouth. It kind of hangs down a little bit. You get that long face look with the mouth wide open. In fact, I was just leaving the gym earlier today and I saw a guy who was trying really hard to work out. You could tell he was. He had a nice little belly to him and he had his mouth open as he was walking. I'm going like, dude, close that mouth. But he may not be able to well because
Hmm.
the one part of the body he wasn't exercising. Imagine this. You got to lift weights. You have to do resistance training. You have to do cardiovascular training. You have to, if you don't use it, you lose it. Somehow we magically forgot about that with the face.
Yeah.
And there are people who don't breathe their nose. And because of that, their nostrils kind of close up. You should see these young kids with these closed up nostrils,
The tiny nostrils.
the tiny nostrils. And how are they ever going to get out of that? I mean, you really have got to think in terms of preserving the airway and facial development. Because I think I told you this before. My younger brother passed away at the age of 59 from sleep apnea.
Yeah.
There's
That's
almost anybody you talk to knows of someone who passed away because of sleep apnea. It does
it's a
happen.
scary statistic.
It's
Yeah.
and here we go back to pregnancy. Okay, so what happens during pregnancy when you have intermittent hypoxia? It can absolutely affect the developing fetus. Now we know most of the research is done with animals because obviously you cannot do a randomized
We just
clinical trial with humans where you
gag
have
off the
half of
pregnant patient's
yeah,
airway.
yeah, block the airway on half of your patients intermittently and see how they respond to that. But when you do intermittent hypoxia, at least in the animal models, you end up with changes in development in the fetus, specifically later on in development. Not so much the first trimester, but later in the second and third trimester, you really end up with lots of developmental changes. Sadly, being a specialist in pediatrics, I used to see all the time kids with sensory issues and developmental delay. You would always ask, well, what was the reason? Did they ever give you a reason for the developmental delay? They go, oh no, it just happens. I hate that. I always want to find out who said that to begin with. What do you mean it just happens? When you walk out in the middle of the road and someone hits you with a car, it doesn't just happen. It's because you're walking out in the middle of the road.
Right.
So, and we have so much bad research out there, and we have so much research that's misinterpreted. But still, we need to go out and find why. And at least in the animal studies, it could be from intermittent hypoxia during pregnancy. So, yeah, every pregnant woman should be screened. And the other funny thing is, again, in the animal research, which I think is interesting, if you do that intermittent hypoxia, the lower jaw becomes underdeveloped. Now, how many times have you seen a baby that's almost missing the lower jaws all the way back? You go like, wait, what? That's really, it's called retrognathia. It's really back because I see babies. Babies would come in to see me for a consultation on tongue tie and lip tie. And probably one of the most amazing things has been to be able to take a baby who cannot feed well, a mom who's extremely frustrated, and in a few minutes with a laser, very atraumatically fix that. So later on that night and the next day, I'd be getting messages, baby's eating wonderful.
Yeah, I had one daughter that had to have a tongue clipping. Are you seeing the incidence of that increase? Are you aware of that? I feel like
I have
I don't know if
been
it's just
told,
awareness of it or if we're just seeing more of it, but I'm sure seeing more of it.
well, we're all aware of it now. We're aware of, tongue tie. We also have to be aware of lip tie. I have had kids with severe lip ties, and someone will have screened them, said there's no tongue tie, there shouldn't be any problems. And I show the parent the lip tie, I go, the lips can't move. The lips have to function during breastfeeding.
Right.
And we'll laser that, which is so atraumatic again, and the baby will breastfeed perfectly fine from then on. No pain for the mom. In fact, my youngest daughter just went for that. She just had my young grandson, who's like 3 weeks old now, but was only a week and a half at the time. They took care of his tongue tie because he was having a hard time. It was giving her a hard time too. It does happen. Now, we are more aware of it, but there are many people who think the incidence is going up. That would not surprise me, simply because the incidence of a lot of things are going up and because of something called epigenetics, where you don't necessarily have every gene expressed. And with epigenetics, as you know, there's something called methylation, which turns on or turn off the gene. There's also another mechanism, histone acetylation, but talk about methylation for now. So you may have had a tendency to have something, but because the jaw is poorly developed, the diet is bad, the lip tie becomes more obvious because a lot of times this happens in utero. And they can see, as you know, on ultrasound, babies swallowing.
Mm-hmm.
Yeah.
Yeah.
So there's a lot of stuff they can see on ultrasound. Dr. Stephen Sheldon from Lurie Children's Hospital is a pediatric sleep specialist, and they have some amazing imaging that they have done showing the issues that they can say, oh, this baby's going to have a problem. They're not even born yet.
Right. You always wish you had a camera and could watch them, and we can sure do that with ultrasound. It's pretty cool too to watch,
It is
fetal
so
MRIs
cool.
and watch what
That's
babies do inside of there.
then
Yeah.
you'd have all the baby pictures are like framed and all that.
Yeah. It's fascinating.
Yeah.
Um, okay, so let's talk about other things that we do to take care of our mouth. So, okay, from a dietary perspective, eat more meat, don't eat a lot of sugar and carbohydrates,
Yep.
get your airway checked. How about how we take care of our teeth? The dentist always told me to brush and floss twice per day. I know that you're definitely against mouthwash. We talked about the chlorhexidine. People should stop using these,
Oh, a lot of
stringent things in their
mouthwashes
mouth.
are bad. There are some that aren't so bad. And I know we've talked about xylitol before. Xylitol is a naturally occurring
But
sugar.
yeah, let's tell our listeners about xylitol.
Yeah, it's a naturally occurring sugar. Xylitol is found in blueberries, plums, very high in plums, found in strawberries. In fact, there's 5 times more xylitol in a strawberry than vitamin C. And
Mm.
xylitol is also produced by a number of bacteria, and the human body produces xylitol. Your liver does about 12 to 15 grams a day of xylitol. And xylitol is produced by a pathway. It's called the pentose phosphate pathway. It's produced from other sugars. Xylitol is used by human and by rat and mouse mitochondria as a start for the energy cycle. It's an electron donor. So it's really a funny little story behind xylitol. It's very natural for humans. Do I have time to tell the evolution of that?
Yeah.
Okay.
Yeah. Please
So,
do.
being hunter gatherers, we went through a crisis, and it's called the marine isotope stage 6, where all of northern Europe was completely frozen, and all of sub Saharan Africa up north became desert. So Homo sapiens, about 195,000 years ago, got forced into what was left that we could survive and not be killed by other predators. Because remember, when there's far less foliage, there's far less to eat for all the herbivores, and you cannot find them. So suddenly, everyone's saber-toothed tiger, everyone's looking for it. Dire wolves, although there weren't dire wolves in Africa, but let's say wolves. We're all looking for this, what is left for prey. And so we ended up moving into caves and by the seaside and eating a lot of seafood. And we didn't talk about seafood because humans have been
Yeah.
consuming a lot of seafood, and we eat a lot of crustaceans, go in the water. And that's why we changed. We lost a lot of our hair. Our hair was actually
Become,
holding us up
yeah,
swimming. Yeah,
not
yeah.
hairy like a caveman. Yeah.
Nope, nope. We
Our
started to
nice,
lose our hair.
smooth
Yeah, we had to
skin.
lose our hair. We moved in the caves. We had fires to keep the predators out, the lions and the wolves out of our caves. But then rats got in and mice got in, but a lot of rats got into our caves. And we would have to eat tubers, which were these big underground plants. And we would have to dig them up because we had the tools and the intelligence. We could dig up these plants, we would roast them, then we would eat them. They're not edible unless you roast them. So only humans were able to use that as a source of energy because we were
Mm.
able to roast
When we
those
couldn't catch
tubers.
fish, then we would roast tubers.
Yeah, it's only as an emergency food supply, but we had to be able to utilize all of it. So we had a big growth of a group of bacteria called the xylobacters, which we don't have anymore. Going back to your meat, we adapted to that, and then we lost that adaptation. We don't have it anymore. There are still tribes in Africa that have those bacteria, but you and I, if I were to measure us for those bacteria to break down those fibers, we don't have them anymore.
Interesting.
Yeah, so that's evolution again. But that's while those fibers can be broken down into xylitol, and it becomes D-xylose and xylitol. So
And
it's,
so, what does xylitol do in the mouth?
well, funny enough, it doesn't hurt the good bacteria. It really messes up the bad bacteria. They try to utilize it because they like sucrose. They love sugar, and they have a hard time distinguishing it. They're trying to utilize the xylitol as an energy source, and they can't use it. See, they got fine-tuned to sugar. And over, especially since the Bronze era, we've been adding more and more sugar to things. And so the bacteria got used to that more and more sugar, and the pathogens use that as their energy to take over the world. And then we throw xylitol on them. They're like, what is this? I didn't come expecting this. I can't utilize this as energy. And they are confused by it. It prevents them from attaching to the human cells. Now let's go on a step and think about, I mentioned that really bad bacteria, the one that causes gum disease and heart
PG,
disease,
Porphyromonas
PG,
gingivalis.
yeah, Porphyromonas
Yeah.
gingivalis, inflammatory Alzheimer's, insulin resistance, diabetes, weight gain. It's been shown associated with many arthritises, da da da. It causes your body to leak. This is what it does. PG invades into your lining cells, your protective cells, your epithelial cells, and they're glued together. They're called tight junctions. It makes them get weak. The junctions aren't tight. Other things flow in. The body goes into chronic inflammation. So everything, you're allergic to everything. Why wouldn't you not be allergic? Your whole immune system's being insulted. Of course you're allergic to everything. But the funny thing about Porphyromonas gingivalis is it attaches, has a special way of attaching, and goes into those cells. If xylitol's there, they can't do it.
Hmm.
It
Interesting.
blocks them from invading to begin with. Now, Porphyromonas is so good at invading when it gets into your bloodstream, like say your gums are bleeding and gets into your bloodstream. If it gets in your bloodstream, it can go inside your defense cells, what are called macrophages, and it
Hmm.
goes around the entire body inside the macrophage or macrophage, and ends up wherever it wants to end up in the body. Because once a bacteria gets into your cells, it's really hard to fight. And you can't get that toothbrush in there. So going back to toothbrushing and flossing, I want to see you get a toothbrush inside the cell or floss inside the cell. You can't, but you can block them from getting in. And blocking them is important because that's how it works also with cancer. Cancer cells can't utilize xylitol. They love sugar. They love sugar. That's why when you are, they have an oncology patient, you're being treated for cancer. What do they tell you to do? Ketogenic diet, right? Go keto. Get those ketones. Yay, ketones. Get the ketogenic diet going. And you know this. But the issue is that the cancer cells can't utilize it. But xylitol also blocks the cancer cells from protecting themselves from your normal T killer cells. That is fascinating because
Wow.
xylitol is anti-inflammatory. It blocks the inflammation in the area. So there's less, it actually blocks blood vessels being formed to tumors. And that's why every study you see published, and of course, they're all animal studies. We haven't had anyone offering to do a human study because someone has to pay for it, right? In all the animal studies, tumor growth is held up by at least 40%. Which is very significant when you look at chemotherapeutic agents and so on. It ranks right up there and is 100% natural. And because it is 100% natural and you can get it anywhere like Whole Foods, you can get it anywhere you go, you can't patent it. There's no money to be made in that. So no one wants to pursue the really good research in
But
cancer.
there's Yeah, but there's lots of xylitol products, and we won't dive into the study, but women chewing xylitol gum less preterm birth, right?
Oh
What a low
yeah,
cost
the
intervention.
famous one. It was a huge study in
Yeah.
Malawi. Yeah, like almost what 9,000, 10,000 women. That was Dr.
Yep.
Kirsty Argard's work from Baylor. And
Yep.
God bless her. We need more people doing things like that. I'm a big fan of hers too.
So there, after I found out about xylitol, I mean, I'm telling you right now, I got the xylitol nasal spray, I got the xylitol toothpaste. Right now, at this moment, I've got xylitol mints on my desk at work and I don't eat carbs, right? Can you overdo xylitol? Can you
Oh,
hurt
at
the
the
good guys?
beginning, you can overdo it at the beginning a little bit and cause a little gastric distress because you kill off all the bad guys at one
Like
time.
diarrhea?
Well, that's actually associated more with sorbitol and mannitol,
Okay.
because they have an osmotic effect. They suck water into the gut.
Right.
Xylitol really doesn't do that, but it can cause a problem because you will start to lose a bunch of bad bacteria at one time. Whenever you do that, there's
Mm.
always that effect, you
What
know.
happens?
Well, you get loose stools and all that. You might have a little
Okay.
gastric distress, but I mean that's like for one day. But you really have to overdo it. I've actually run into very few people who've had that problem.
But aren't you just like pooping out the pirates? I love your analogy of the pirates. I've used that so many times since you told me that, Mark. I don't know if you remember telling me about
Oh,
the cruise ship. So, like the
yeah,
commensal bacteria in our bodies is like the passengers on a cruise ship, and you've got the crew and the captain driving the ship.
those are
And
the
then
probiotics,
pirates, these
and
pirates can
yeah,
come
the
in
pirates are the
and
pathogens.
they will, they will take all your booty. They will sink your ship. They will, yeah. So I love that analogy so much.
Well, it's
So,
so true because the commensals, if you die, they die, and the probiotics are there to help you survive. And they do so many great things for you when it comes to your immune system and preventing the bad bacteria. And you know what? It's called a catch-22. I know I've told you this. I have this catch-22 lecture I used where I tell people, kind of a catch-22. You have to keep feeding the good guys too. And you have to have the good guys to begin with to feed them. People say, well, I eat a really good diet. Well, I bring back all the good bacteria. Now, if they're gone, where are they going to come from?
so how do you feed them?
Oh, well, it depends on what they like to eat. I mean, there are bacteria out there that pretty much survive on, like, red food, red meat, actually. There are bacteria who survive well on red meat. And some pathogens do too, like Porphyromonas gingivalis. It'll grow fine on red meat. But you can feed them just basically by exercise. When you exercise, you produce a lot of metabolites, and that's just products from you working out, lactates and so on. That stimulates certain bacteria to break down the lactates, and they become actually food for the other bacteria. That's why professional athletes have completely different gut microbiome. Regardless of diet, they have completely different gut microbiome from
Fascinating.
someone who is sedentary. And theoretically, if you do bacteria transfer, a fecal matter transfer from a excellent athlete to someone who isn't, the person who is an excellent athlete will become better because they're going to be
Ooh.
better at actually utilizing what they're given for food.
I wonder if the World Anti-Doping Agency is on this. People
Actually,
doing fecal transplants in the,
they
in the back
are.
alley.
Actually, they are.
Wow.
Because there
Wow.
have been reports of people in the
Oh
past
my
doing that.
God.
The fecal
First
matter
it was blood
transplants,
doping.
yeah, I know.
Gosh.
Fecal matter
Now the
transplants,
bicyclists are trading poop.
yeah.
Yeah.
They do a lot of good. Look at those random studies have come out of there with fecal transplants treating, depression, anxiety, obsessive compulsive disorder. In Europe, they're way ahead of us. Europe's way ahead of us on this because they have universal donors. So they're using fecal transplants for everything to cut back on diabetes, weight gain, all these things. So I can't wait for us to do that one day. I would actually say one day what we should do is someone says, I'm 20, I'm going to start having my family when I'm 23. Great, we're going to sign you up. You're going to start working out. You're going to
Yep.
avoid all these carbs. You're going to increase your intake of good food like good meat, good
Are my
eggs.
patients listening
Yeah,
right now? Are
yeah,
you guys
yeah.
listening?
And and you're going to go ahead and start doing some probiotics, and maybe by that time there is a fecal transplant capsule now finally approved in the United States after all
Poop capsule?
the poop
No
capsule,
way.
yeah. And take some poop capsules, get everything good because when you have that baby, everything's gonna be normal. Your airway's gonna be normal, your breathing normal, your bacteria normal, your body's normal, you're the healthiest you've ever been. That would be the ideal dream, wouldn't that?
Okay, so what are these probiotics though that we should be taking? I've been reading a lot about like Akkermansia. Like what there's so many out there though. You go to the aisle, there's, Bifido, Lactobacillus. How do we know what probiotics to take?
Akkermansia symphilia is the second generation group. And it's the first and the second generation. There's other second generations out there. That is one I think is a dream probiotic because it is actually a normal resident of the mouth, the gut, and the nose, and it helps seal leaky gut.
Mm.
So if you
Okay.
suspect leaky gut, Akkermansia is definitely the route to go on that. Now for oral one, we have a bunch of choices on oral that are good. I know you've used some ProBio Pro before, which has a good three streps. We already mentioned the strep oralis. That's one of the good guys that produces hydrogen peroxide that kills bad guys who hate oxygen. So ProBio Pro is a good one. Another one, especially for kids, I used to use a lot was the BioGaia one, and that's that Lactobacilli rhodori using the German
And they make a
pronunciation.
lot of pregnancy products.
Oh,
Yeah.
they make a
Yeah.
lot of pregnancy products. They have products available for pregnancy, prenatal. They have the one for breastfeeding. And I have to tell you, of
Yep.
course, I'm big on giving that to my daughter-in-law and my daughters and for things like that because everyone they'll tell you too their babies are much healthier, much happier. Look at the rate of colic we have in the United States. It's
Hmm.
atrocious. One out of
And
three
then they're like, oh,
babies.
it's the mom's diet. Try this formula, try that formula, try this formula. Like, ooh, these moms can get into the rabbit holes.
Oh, they can. It's so cruel. I mean, it's absolutely cruel because they keep telling them in a way it's the mom's fault and all that. It's really not the
Yep.
mom's fault. They really should be explaining, I'm sorry we didn't tell you this earlier. That's what they should be saying. I should have told you this earlier, but if we could get started now getting a healthy microbiome for you and the baby, and there are good probiotics to give the babies too. And there's people out there who've done studies showing the effectiveness of this in reducing colic. Um, and
Yeah,
for
they make a lactobacillus reuteri drop. You can literally just put it on your nipple and breastfeed, or you can put it in the baby's mouth, and it's very simple. Your baby doesn't have to swallow a capsule, but
oh yeah, it is simple. And that company has been around for a very long time. In fact, I used to bring their products back from Europe. I was lecturing in Europe because I couldn't quite get them yet in the United States. When they finally got here, I was very happy. And I mentioned the other one too, the Probiora. That's another good company too. That research goes back to some famous people, some actually mentors. I mean, not mentor that they mentored me, but certainly people who are giants in their field.
wow.
So,
Well, hey, Mark, so for people listening who want to find, I keep hearing words like functional dentist or because you're so connected in the dental world, for somebody listening, how do they find like a dentist like you that really understands these, chronic systemic connections, airway, oral microbiome? Is there like a way to find those practitioners?
well, if you find someone who's actually associated with a group like AOSH, the American Academy for Oral and Systemic Health, which you've lectured to them, you know
Yeah.
how enthusiastic they were at your presentation. We're people who are very connected to understanding the whole body. Again, functional, looking for the root cause, integrative, and thinking in the terms of always trying to find every aspect. So when we treat, we just don't treat one feature, we go after the nutrition. I mean, how can you possibly be seeing a dentist and have that dentist not say something to you about carbohydrates? I mean, that should be the first clue. If they don't walk in and say, how's your carbohydrate intake? What are you doing for a good diet? You should be worried because back in the old days, when we used to have these exams to be fully boarded, like as a pediatric dentist, one of the things you had to show was that you're doing food diaries for the kids, and you had these posters on nutrition talking about the evil of sugar and how sugar was making people diabetic. Back then, we had no idea that we'd be at a phase where we would have 1 out of 3 adults in pre-diabetes, according to many surveys, and the pre-diabetics, 8 out of 10 don't know they're a pre-diabetic.
Yep. Huge problem.
And yet
Huge
our
problem.
posters are gone.
Yeah.
Bad
It's
timing, to say the least.
terrifying. It's terrifying. Okay, so we're going to wrap up here. We're going to move to what I call the semen analysis. And for this, I guess I just want to give really big takeaways for our listeners that the airway is so important. If you or your partner snores, get your airway evaluated and figure out how to get that fixed. If your kids snore, figure that out as early as possible. Understand that for babies, this jaw development and airway development starts with breastfeeding. It starts with the cups and sippy cups and things like that that you're giving your kids, and then them chewing and eating meat and getting that normal jaw development. When it comes to your diet, don't overeat carbs and sugar. Eat more meat. We know that excessive carbs and sugar are horrible for the oral microbiome and increase your risk of all chronic diseases and pregnancy complications. And of course, in pregnancy, it matters because you are setting the story basically for your baby and for your child when they're in utero. Xylitol, an excellent thing for the oral microbiome. Exercise. Oh my gosh, that was actually a takeaway for me, Mark, in this podcast. I didn't even realize just exercising and the things that get secreted actually have a bidirectional relationship with our microbiome. And that it really feeds those good bacteria. And then for people who are, listening, saying, God, I wish my doctor understood this. American Academy of Oral and Systemic Health, you can find practitioners in there that know what the heck we're talking about. Any other big takeaways for people listening, Mark?
Oh, no. Take time to go outside and smell the roses because being
Yeah,
outside
sunlight.
affects your, yeah, sunlight, but just being outside affects your microbiome. And if you are worried about green, go take a good walk where it's really green. Because again, the studies on aging and epigenetics show the more green that is around you, not necessarily that you're eating, but that is around you, is
Green under
very,
your feet, not in your mouth,
yeah,
okay?
is really important. And again, because in the soil, there's some extremely valuable probiotics, and there's one bacteria species. I know we talked about this a long time ago. There is one bacteria species that is essential for life, and we keep
Go
trying
on.
to kill it.
Go on.
Well, it's Clostridia sporogenes. And Clostridia sporogenes converts indole and propionic into 3-indole propionic, which makes no sense to most people. But it's a plant hormone. It causes plants to bud and to branch out.
Mm,
And so you
fascinating.
remember the cattle have to eat something.
Yeah. Yeah.
Yeah. So you definitely need to keep Clostridia sporogenes alive. And oddly enough, it is protective. It's a neuroprotectant bacteria. Does the same in humans in your gut. It takes indole, which is a neurotoxin, propionic acid, which if it gets too high, has been linked, no, I shouldn't say linked, you create autism in animal models by giving them propionic acid.
Mm,
It
mm.
combines the two to make them a neuroprotectant. And that's the other thing we didn't talk about was autism on my research on autism. We got started with it. But that's
Yeah,
actually,
give us a little insight. It could be probably be its own podcast, but
yeah, it's a
yeah.
strong epigenetic thing. I got started working with autism because got a I ran into one of the great researchers in autism, a neuroscientist, and we were giving lectures at the same time, back to back, at an important meeting on disabilities. And I was talking about the Rothia bacteria breaking down gluten, and he was talking about the problem with certain propionic bacteria producing too much propionic during development of a baby, and how that could create how he had all these beautiful slides, and he how they would take animals, again, rats, specific rats. They can make them all autistic by giving them the propionic acid into the brain, and then they did it in the food, and then they get it in the water. Then they did other studies where they gave it to pregnant rats, and the little pups, little rat pups. There'd be much higher incidence of autism in the pups. Absolutely no social behavior with them at all. And then histopathologically, when they looked at the brain in sections, it would look exactly like autism. And we realized we were actually barking up the same tree. And we started to
Mm,
work together, and that's why we did that great study on it. And we found that, again, like many studies, that bacteria is often missing. Famous research out of Little Rock, Arkansas Children's Hospital, too. Those bacteria are often missing in moms of kids who are, have autism. They're missing Clostridium sporogenus. There's a bunch of articles published on it overseas. And it's one of the reasons people are trying to ban Roundup, because glyphosate, Roundup, kills Clostridium sporogenus.
Interesting. What can we do about it? I mean, besides
Awareness.
stop using Roundup.
Yeah, stop using
If there's a
Roundup.
mom listening, maybe who has a child with autism,
Yeah, stop
what?
using Roundup. I mean, it's an indirect thing. Many things in life are indirect. They go through several layers of action before it actually causes the action. And when we did the study with the kids, the 30 kids with autism, we intervened with probiotics and prebiotics. And in a third of them, we had a great increase in their capabilities. I mean, significant
Interesting.
change in their capabilities. Now, we're not the only ones. Since then, there's been a number of studies out there. And you have the famous research coming out of Arizona State University by James Adams and others down there, where they've been doing fecal matter transplants again.
Poop
Poop
transplants.
transplants again to kids with autism. Their improvement rates have been phenomenal. How many kids have gotten massively better? And it's one of the things that parents do know about, because there's thousands and thousands and thousands of kids trying to get on the studies down there. It'd be so much easier to do in Europe than here in the United States. But sadly, people have gone elsewhere to have it done, like Mexico and all that, usually not with great results, because we mentioned Roundup a couple of times. If you
Yeah.
want to get rid of everything, you have to clear it out first, then replant. When you just do a poop transplant and you still have all the bad bacteria in there, it doesn't work that well. The
Okay.
bad guys tend to come back.
Yeah.
You lose the benefit of your poop transplant.
Got to weed the garden a little bit before
You
you
gotta
plant it.
weed the garden, you gotta till the soil. And so over the people who know how to do this, they are actually going in there and they're doing a good gut cleansing first. I've always told them just use a lot of xylitol. Have the kid just sit there and eat package after package of xylitol, and then everything will come out. And then you do the poop
Interesting.
transplant, and the kid will enjoy doing it.
Interesting.
Because we have some great. Oh, I gotta show you these. Oh my heavens! Like I'm sitting right in front of me.
I got some xylitol candy for my kids to con them into, but I've
This
got
is
these.
the soft, sticky xylitol candy.
Oh, interesting.
So
Yeah.
it stays on your teeth for a while. Can't show you anything. You didn't see it.
Is this a new product
It's a
coming?
new
Is this
product. Yeah. Yeah.
okay? I'll be a sample. You can my
It's
address
really
is
good because that's what
yeah.
kids want, something soft and sticky. This was actually
Yeah.
being developed for a school project where we're hoping to get some schools going, especially kids in the Title I schools are having so many issues health wise, to get
Yeah.
intervening with them in good food, removing all the processed food from those kids first. Oddly
So give
enough,
them a ton of xylitol, give them some prebiotics and probiotics, and replant the garden.
when they have done studies, like they did some massive ones in Europe at nursing homes, removing processed food, heavily preserved food, and bringing in fresh food, they thought it was going to cost more money. It actually did not. They actually ended up saving money. The amount of insulin, metformin, and everything went down significantly, and the health of everyone in
Wow.
those nursing facilities improved dramatically. The reports were dramatic change in cognitive everything. We are killing ourselves with our diet.
Yeah. Oh God. Yeah. Preaching to the choir there.
I know.
Well, Mark, this has been incredible. I am so happy that we have had this conversation. For those of you listening, if you heard something that you had a huge takeaway, please send this podcast to somebody, because I tell you all the time, we rely on you to spread these messages around the world. And it's true. Mark and I have a circle of people, a circle of influence, but we literally depend on you guys to spread these messages and to keep these areas of research going. And wow, I can't even imagine in the next 5, 10, 20 years, where this research will lead us and the things that we'll be doing. But for the people listening, there's so many things they can control. They can control what they put in their mouth. They can start with their diet. So we appreciate all of you, and we will catch you on the next episode. Thanks, Mark.
Thank you.
Did you guys love that last episode of the Fit and Fabulous podcast? Well, of course you did. And I want to keep bringing you the most amazing content from the most incredible people. And you can help me by subscribing to the Dr. Fit and Fabulous channel. You guys know where the button is. Just click it. It's the doctor's orders.